Have you been feeling drained, moody, or achy for no clear reason? Your body might be trying to tell you something, loudly. A lack of vitamin D3 doesn't just sneak up on you. It screams through persistent fatigue, frequent colds, bone pain, and even depression. These aren't random discomforts. They are red flags. Your body could be in urgent need of the sunshine vitamin. Recognizing the signs early can be the difference between thriving and merely surviving. Vitamin D3 is not just about bone health. It's essential for immune function, muscle strength, and mental clarity, says Dr. Grace Mitchell, clinical nutrition expert. Despite its importance, millions unknowingly suffer from D3 deficiency, especially those who spend limited time outdoors or live in areas with little sunlight. Vitamin D3 helps the body absorb calcium, supports neuromuscular health, and plays a critical role in regulating mood. Its deficiency often presents with subtle yet progressive symptoms that are easy to dismiss or misattribute to aging, stress, or poor sleep. In this article, we'll explore 5 key signs that your body is crying out for help. Understanding these symptoms not only empowers you to take control of your health but also helps prevent long-term complications like osteoporosis, weakened immunity, and chronic fatigue. Don't ignore the silent alarms. Your body might be screaming for vitamin D3 right now. Feeling tired after a long day is normal. But what if you're waking up exhausted, needing naps throughout the day, and still feel like your energy never fully returns, even after a full night's sleep? This isn't just regular tiredness. It may be your body's desperate cry for vitamin D3. Vitamin D3 plays a vital role in how your cells produce and use energy. Without it, the mitochondria, the tiny power plants in your cells, don't work efficiently. As a result, your body struggles to generate the fuel it needs, leaving you feeling constantly sluggish, no matter how much rest you get. Many people mistakenly attribute this kind of fatigue to stress, aging, or even burnout. They try to compensate with caffeine, more sleep, or dietary changes, often with little effect. That's because the root of the issue isn't being addressed. Research shows that vitamin D deficiency is strongly linked to chronic fatigue and low stamina, particularly in older adults and those who spend little time in the sun. One of the challenges with fatigue caused by low vitamin D3 is how nonspecific it is. You might not immediately think a vitamin is to blame. There are no dramatic symptoms, just a slow, persistent energy drain that creeps into your daily life. You may notice tasks that used to feel easy now leave you winded. Or you might feel mentally foggy, as if your brain is wading through molasses. If this sounds familiar, it's worth requesting a blood test to check your vitamin D levels. The solution could be surprisingly simple. With proper supplementation and a bit more sunshine exposure, many people report a noticeable improvement in their energy within weeks. Constant fatigue doesn't have to be your new normal. Sometimes, the answer lies not in doing more, but in restoring what your body silently lacks. Vitamin D3 might be the missing piece. If you find yourself catching colds more often than others, taking longer to recover from the flu, or experiencing recurring infections, your immune system may not be operating at full capacity, and a lack of vitamin D3 could be to blame. Vitamin D3 is not just a bone builder. It plays a central role in regulating the immune response. Your body uses it to activate T cells, which are essential defenders that detect and destroy viruses, bacteria, and even cancerous cells. Without enough D3, these cells remain sluggish or inactive, leaving you more vulnerable to illness. People with low D3 levels often report being sick all the time. Even minor respiratory infections can linger longer than normal. They may also develop unusual infections, like recurring sinus issues, bronchitis, or skin problems that resist healing. These aren't isolated incidents. They're a sign that your immune defenses may be compromised. Studies have shown that individuals with adequate levels of vitamin D3 have stronger immune responses and are less likely to suffer from severe outcomes of viral infections. During colder months or periods of limited sunlight, when D3 synthesis drops, there's often a spike in flu cases. This is not just a coincidence. Another overlooked symptom tied to immune dysfunction and low D3 is chronic inflammation. If you're experiencing random joint pain, muscle aches, or digestive flare-ups without a clear diagnosis, it could be your immune system misfiring in the absence of D3 support. Chronic low-grade inflammation wears down the body and can trigger or worsen autoimmune conditions. The good news is that this issue is fixable. Replenishing vitamin D3, either through responsible sun exposure, dietary sources like fatty fish and fortified foods, or quality supplements, can significantly improve immune resilience. In fact, some clinical trials suggest that daily D3 supplementation may reduce the risk of upper respiratory tract infections by up to 50%, especially in people who were previously deficient. Don't ignore the warning signs. If your body is constantly under siege, it may not be about external germs. It may be that your internal defenses are underpowered. Vitamin D3 could be the natural immune booster you didn't realize you were missing. Persistent bone pain and aching in the lower back are often dismissed as part of aging or poor posture. But what if these discomforts are actually your body's way of warning you that it's starving for vitamin D3? Vitamin D3 plays a vital role in calcium absorption. Without enough D3, your body can't properly transport calcium from your diet into your bones. Over time, this leads to decreased bone mineral density, making bones weaker, more brittle, and prone to microfractures, especially in weight-bearing areas like the spine and hips. This deficiency often manifests first as dull, lingering pain in the bones or a deep ache in the lower back that doesn't improve with rest or stretching. Unlike muscular pain, which is often sharp or tied to movement, vitamin D-related bone pain tends to be persistent and generalized. People describe it as a deep nagging discomfort that feels like it's coming from within the body, not from strained muscles. This pain may worsen after long periods of inactivity or during the night, making sleep more difficult. In older adults, especially those post-menopause or with limited mobility, the risk is even higher. The pain might not just be uncomfortable, it could signal the early stages of osteomalacia, soft bones, or contribute to the silent onset of osteoporosis. In both cases, the bones gradually weaken from the inside out, often without dramatic symptoms until a fracture occurs. What's particularly concerning is that this symptom is often misdiagnosed. Patients may go through rounds of painkillers, physical therapy, or even unnecessary imaging before someone checks their vitamin D levels. A simple blood test could reveal a deficiency that's both treatable and preventable. If you've been living with unexplained bone or back pain that doesn't seem to respond to typical solutions, it's time to consider your D3 status. Supplementation, combined with weight-bearing exercise and proper nutrition, can dramatically reduce symptoms and even reverse early bone loss. Don't let this pain become part of your daily life. Sometimes the answer is not more treatment, but the right nutrient. And in this case, vitamin D3 might be exactly what your bones have been craving all along. Have you been feeling unusually irritable, anxious, or emotionally low, even when life seems stable? If your moods are swinging unpredictably or you're experiencing persistent sadness, the root cause may not be psychological at all. It could be biochemical. More specifically, a lack of vitamin D3. Vitamin D3 is deeply intertwined with brain health. It helps regulate the production of neurotransmitters such as serotonin and dopamine, key chemicals that influence mood, motivation, and emotional stability. When D3 levels are low, these neurotransmitters become imbalanced, making you more prone to mood disorders like depression and anxiety. In fact, multiple studies have found a strong association between vitamin D deficiency and depressive symptoms, particularly in older adults and those with limited sun exposure. People often describe a persistent, emotional fog, feeling detached, unmotivated, or overwhelmed by everyday tasks. Others report sudden irritability or emotional sensitivity, crying more easily, or struggling to enjoy things that once brought pleasure. What makes this even more concerning is how easily it's overlooked. Many people struggling with mood issues turn to therapy or antidepressants, which are often helpful, but they might never check their vitamin D levels. And while emotional health is complex and influenced by many factors, ignoring the biochemical piece can mean missing a simple and powerful solution. There's also a seasonal aspect. If your low moods tend to worsen in the winter or during periods of overcast weather, it might not be just the blues. Seasonal affective disorder, SAD, is closely linked to a drop in vitamin D3 production due to lack of sunlight. Supplementation during these times has shown significant benefits in both mood stability and energy. The encouraging news is that restoring D3 levels can lead to noticeable improvements in emotional well-being. Many people report feeling lighter, more clear-headed, and emotionally resilient within weeks of consistent supplementation. Combined with other supportive practices, like exercise, healthy eating, and social connection, vitamin D3 can be an essential part of your emotional healing toolkit. So if your heart feels heavy and your mind unsettled, don't just assume it's all in your head. Your body might be trying to speak through your mood, and what it's saying is, I need vitamin D3. Have you noticed that cuts, scrapes, or bruises seem to linger longer than they used to? Or maybe your skin feels more inflamed, dry, or prone to breakouts than usual? These surface-level symptoms might actually stem from something deeper, your body's shortage of vitamin D3. Vitamin D3 plays a critical role in skin health and wound repair. When the skin is injured, the body triggers a complex healing process that involves immune activation, inflammation control, and tissue regeneration. Vitamin D3 is involved in all three phases. Without adequate D3, healing becomes delayed, and inflammation can linger longer than it should. This is particularly concerning for older adults, people with diabetes, and those with chronic skin conditions. Minor wounds that used to heal in days might now take weeks. Even small scratches can become red, swollen, or infected more easily. These aren't just cosmetic inconveniences. They're signs that your immune and inflammatory systems are struggling to function properly. In addition, vitamin D3 contributes to the production of antimicrobial peptides in the skin, which help fight off harmful bacteria and support the body's first line of defense. When D3 is low, these peptides are reduced, making the skin more vulnerable to infections like cellulitis, acne flare-ups, or fungal overgrowth. Skin conditions such as eczema, psoriasis, and chronic dryness have also been linked to D3 deficiency. Though not the sole cause, insufficient vitamin D3 can exacerbate flare-ups, prolong inflammation, and reduce the skin's ability to recover after irritation or damage. What's troubling is how often these symptoms are chalked up to aging or poor skincare routines, when the real issue lies within. A person could spend hundreds on lotions or topical creams, yet see little improvement because the problem isn't on the surface, it's systemic. Fortunately, vitamin D3 supplementation, when guided by proper medical advice, can significantly enhance skin recovery and overall resilience. Some people notice quicker healing times, reduced inflammation, and fewer infections within weeks of restoring their D3 levels. If your skin feels like it's lost its natural ability to heal and protect, it might not need another serum. It might need sunshine. Or more precisely, the sunshine vitamin your body's been silently missing, vitamin D3. Hair shedding more than usual? Struggling to lift things that once felt light? These changes may seem unrelated, but both could be warning signs that your body is running low on vitamin D3. Let's start with hair loss. While many factors can contribute to thinning hair, like genetics, stress, or hormonal changes, vitamin D3 deficiency is increasingly recognized as a hidden culprit. Vitamin D3 stimulates hair follicles and helps maintain the normal hair growth cycle. When your levels drop too low, hair follicles can prematurely shift from the growing phase, anagen, to the resting or shedding phase, telogen, resulting in noticeable hair thinning or patchy hair loss. This is especially true for people suffering from autoimmune hair disorders like alopecia areata, where vitamin D deficiency has been found to worsen symptoms. Even in people without diagnosed hair conditions, low D3 levels can cause a general weakening of the hair shafts, making them brittle, dry, and prone to breakage. Now let's talk about muscle weakness. Many assume their declining strength is a normal part of aging, but it's not always that simple. Vitamin D3 is essential for muscle contraction and function. It helps muscle fibers absorb calcium properly, which is key for movement, coordination, and strength. When D3 is lacking, muscles become weaker, slower, and more prone to cramps or aches. This isn't just about struggling at the gym. People with D3 deficiency often report difficulty with everyday activities like climbing stairs, lifting grocery bags, or getting up from a seated position. Some may even develop a higher risk of falls, especially in the elderly, due to compromised balance and muscle control. The combination of thinning hair and weakening muscles can feel like your body is aging rapidly, but these symptoms are often reversible. With proper D3 supplementation and lifestyle changes, many people see improvements in hair density, physical strength, and energy within weeks to months. Your body might be whispering, or even shouting, for help through these physical changes. Don't ignore them. Hair and muscles aren't just vanity and mobility issues, they're reflections of your internal health. And vitamin D3 may be the simple, powerful fix you've been overlooking. Ignoring the signs of vitamin D3 deficiency can lead to serious long-term health consequences. Without adequate D3, bones become brittle and prone to fractures, muscles weaken, and immune defenses drop, leaving you vulnerable to chronic infections and inflammation. Mental health may also decline, increasing the risk of depression and anxiety. Over time, the body's inability to properly heal or regulate basic functions can result in conditions like osteoporosis, autoimmune disorders, and persistent fatigue. These outcomes don't just reduce quality of life, they increase the risk of disability and disease. The longer the deficiency goes untreated, the more damage quietly accumulates beneath the surface. According to Dr. Grace Mitchell, clinical nutrition expert, vitamin D3 deficiency is both common and highly treatable. The key is not to ignore the subtle signs your body sends. She recommends starting with a simple blood test to check your D levels, especially if you're experiencing fatigue, muscle weakness, frequent illnesses, or mood changes. If you're deficient, daily supplementation under medical guidance can restore your levels safely and effectively. Dr. Mitchell also emphasizes natural sources. Spend 15 to 30 minutes in sunlight each day, when possible, and include D-rich foods like salmon, fortified dairy, and egg yolks in your diet. For those with limited sun exposure or absorption issues, high-quality supplements are essential. She adds, treating vitamin D3 deficiency can dramatically improve your physical energy, emotional well-being, and immune resilience. It's a small step with life-changing impact. Listening to your body, and acting early, can make all the difference in your long-term health. Your body has been sending signals, now it's your turn to respond. If you've recognized even one of these warning signs, don't wait. Talk to your doctor, check your vitamin D3 levels, and start making changes today. A healthier, more energized life may be just one nutrient away. If this video helped you understand your health better, please like, share it with someone who needs it, and subscribe to our channel for more expert-backed wellness insights. Leave a comment below if you've experienced any of these symptoms. We'd love to hear your story and help you take your next step toward better health.